was born in the Gertown area, spent a lot of time in Acalia with my mother's family, and around the age of 8, I moved to the 9th Ward. This is the block I grew up on. We played baseball right here in the street, football all around this block. I wasn't good at either. It's kind of like you don't know what you don't have because that's the environment you've always grew up in. And doing this work, I get to consider the world with a different lens. I pay more attention to which resources are where and how they're positioned in the different communities. Driving through the 9th Ward, you might see an FQHC, which is great. You'll see some schools, which is great. But you won't see the healthy eating options. You won't see the fitness centers. You won't see all the other things that we have in other parts of the city and other parts of the state that allow us to not have those poor health outcomes in those spaces.
Okay, it was two things that we did as a family that I did not know he didn't like. When you got baptized, you was in a choir. So
I think I am the person that I am because of my parents, because of my father and my stepmother and my mother. They taught me that family is what's important in life, that integrity matters, and that when you do something, it has to be more than about yourself. That line goes, and then this line goes, and that line goes.
Yeah.
That might work really well.
We just staggered.
I didn't know you were out here. You've been out here the whole time? My vision for the community health center is that it's seen as a center, not just a clinic. So we have primary care, pediatrics, women's services, behavioral health. Those are all addressed. And we focus on the social. We focus on transportation insecurities. We focus on healthy eating options. We focus on active lifestyles and the need to increase workforce opportunities within those centers. What's different about this approach, I think, is that not only are the geographies more expansive as far as where we'll be placed and more varied, but we're very intentionally targeting underserved populations. So we will be within the community of those patients that have not previously had this opportunity. That is our vision as to what these centers are and how they're connected within the community. And I think that happens by building trust. Have a great rest of your day. Are you working the rest of the day or? There's been a ton of great work accomplished by the federally qualified health centers. And we are here to collaborate and help to move this effort forward. The reason why we rank with poor health outcomes in our state is because we have high rates of obesity, smoking, diabetes, hypertension. Our healthy state goal is to shift our current health outcomes from where we are today from the 50th to the top 40 within 10 years. All the skills and experiences in my life as a child, as a young adult in the city, have come together at the perfect time so that I could do this work and understand the community, yet have the skills and ability and experience to lead. And if there's a reason why I think this journey is one that I'm taking with Ochsner, is that I know the person I am and aspire to be is what the organization is and is aspiring to be.